Okay, hello everybody. My name is Alejandra Salazar. Today I'm going to talk about what are the effects of drowsiness and sleep disorders. So I have three goals for this video. One is a basic introduction to the sleep cycle and rhythm. The second is the dangers of drowsiness. And lastly, I'll talk a little bit about two sleep disorders, sleep insomnia and sleep apnea. Okay, so the sleep cycle and rhythm. What is it and how does it work? So what is a sleep cycle? The rhythmohypothalamic or RHT pathway transmits light and dark cues from the eyes to the suprachiasmatic nucleus. This nucleus is what we call our circadian clock. Circadian means recurring naturally on a 24-hour cycle, like our 24-hour long days. This is what we refer to as our sleep cycle or sleep rhythm. The Quran stresses the importance of the daily pattern of light and darkness and considers the cycle of night and day as a mercy from Allah in Surah Al-Qasas. Quote, if Allah were to make the night perpetual over you to the day of judgment, what God is there other than Allah who can give you enlightenment? If Allah were to make the day perpetual over you to the day of judgment, what God is there other than Allah who can give you a night in mercy in which you can rest? It is out of his mercy that he has made for you night and day. Why is day and night so important for our sleep cycle? So again, the RHT pathway transmit light and dark cues from the eyes all the way to the suprachiasmatic nucleus. So during our 24-hour-long days, the daily switch from day to night helps guide our bodies about when to be asleep and when to be awake. So this switch from day to night is a crucial part of our sleep cycle. Okay, but what if you don't get enough sleep? So now we're going to talk about the dangers of drowsiness, how it happens, and what are the potential effects of drowsiness. So the main cause of drowsiness is sleep deprivation. So sleep deprivation means getting less than the necessary 7 to 8 hours of sleep or no sleep at all. The less we sleep, the more sleep we need, and sleep is an essential restorative process for energy balance and cognitive function, particularly learning and memory. So what are some effects of drowsiness? Here I'm going to talk about four main effects of drowsiness, starting with irritability. Being drowsy can cause you to become easily irritated or angry at small things. You can also become more sensitive to stressful situations. The second effect is inattentiveness. Drowsiness can cause inattentiveness, which is failing to pay attention. This can make it difficult to focus on work, school, or driving. The third effect I'll talk about is prone to infections. So sleep deprivation makes you more prone to infections. And this is why when you get sick, you often have a great desire to get a good night's rest and get some sleep. And the last effect of drowsiness I'll talk about is fatigue. So when you're experiencing fatigue, you're extremely tired or exhausted. And driving while fatigued can lead to fatal car accidents due to decreased reaction time. So getting the appropriate amount of sleep is essential to avoid drowsiness, and these 4 examples of the effects of drowsiness. All right, and now we're going to talk a little bit about sleep disorders, insomnia, sleep apnea, and their effects or consequences. So starting with insomnia, 1 in 4 women experience insomnia, and 20 to 60% of women experiences insomnia. 20 to 60% of pregnant women experience insomnia, compared to the less than 1 in 5 men who deal with insomnia. Now, when it comes to adolescents, around 10% of adolescents deal with insomnia. And insomnia also has a genetic predisposition, and the heritability can be anywhere from 14 to 71%. And now we're going to talk a little bit about sleep apnea. So some causes of sleep apnea, or some people who might be more predisposed to sleep apnea, are people with polycystic ovary syndrome, or PCOS. So PCOS patients have a higher risk of sleep apnea. Also, men and boys have a high prevalence of sleep apnea in comparison to women. Weight also has an impact on your propensity to have sleep apnea. The most common cause of sleep apnea is excess weight and obesity, because the soft tissue can oftentimes block the airway while you sleep. And the last thing I'll mention is age. So the prevalence of sleep apnea increases with age, and it oftentimes resembles dementia in older adults. Okay, so the last thing I'll talk about is some effects of having insomnia and sleep apnea. So insomnia and sleep apnea are both forms of sleep deprivation, and there are many side effects that can happen from having sleep deprivation. And we'll start with the first point. So first, adolescents with sleep deprivation can experience anxiety, depression, and even thoughts of suicide. Insomnia can also lead to a decreased quality of life and productivity. Third, similar to adolescents, adults can also experience depression and anxiety due to sleep deprivation. Fourth, due to sleep deprivation, we can see increased accidents, particularly when experiencing sleep deprivation behind the wheel. My fifth point, chronic sleep deprivation can also impact your physical health, such as high blood pressure, heart disease, and coronary artery disease. And lastly, sleep deprivation can negatively impact both short and long-term memory, affecting how you process and remember information. So more than 1/3 of the adults in the United States report not getting enough sleep on a regular basis, according to the CDC. If you're experiencing problems with your sleep, please remember that your sleep can definitely improve. Even many sleep disorders are treatable. So if you're struggling with sleep deprivation, prioritize improving your sleeping habits, such as socializing, exercise, light exposure, and food intake. Okay, thank you so much.